All right, I will get us kicked off here. Hello, everyone, and welcome to the second of our two town halls for the Alzheimer's Association Washington State Chapter's 2022 Town Hall Series. I'm Brad Forbes, and I am the Director of Public Policy for the Washington State Chapter of the Alzheimer's Association. And I have Nicholas Hart here with me, and I'll give him a chance to introduce himself in just a moment. First and foremost, we really appreciate you being here with us today for an update on the work that we're doing with our elected officials to better serve those affected by dementia and all other, those affected by Alzheimer's and all other forms of dementia in Washington. We're going to begin with a review of some of the policy work that's being done at both the federal and then state levels, and then at the end, there will be time for any questions or feedback that you may have. So just a couple of housekeeping items before we get going. If you're having trouble or seeing or hearing us, please know that that issue may well be with our technology. So feel free to use the chat and we will do the best we can to address it, whether the issue is on our end or yours. And also at the bottom of your screen, you'll see a Q&A button. And so if at any point during today's town hall meeting, you have a question, feel free to enter it into the Q&A function, and then we will have an opportunity to address those at the end. So please just enter the questions as you have them so you don't need to try and remember them for the end. And so with that, I'd like to hand it over to Nick to get going with today's town hall presentation. Nick, take it away.
Thank you, Brad. I don't know if folks can see me on the video, but I hope you can hear me.
We can hear you, yeah.
Okay, sure. So if we could just go ahead and go to the next slide here. We can go ahead and take a deep breath. I know it's been a little bit since the beginning of November, but the political ads are over. So in other words, you probably know that we had some elections recently. So let's just go ahead and review the makeup of Washington's federal congressional delegation and the members that we'll be working with next year. So the vast majority have stayed the same, with one exception. Marie Gluesenkamp-Perez in CD10 in CD3 will be succeeding Representative Jamie Herrera Butler in the Vancouver area. And Jamie Herrera Butler was a tremendous supporter of our congressional priorities. So we'll start working with the Alzheimer's advocates in that district to forge a brand new relationship with this member. And that gives us the chance to sort of dust off our playbook when it comes to engaging members who have just recently been sent to Capitol Hill. So we look forward to doing that. And on the next slide here, we'll talk a little bit about research in context. So this has a lot to do with our work with these members of Congress. Some background, for decades, Alzheimer's advocates across the country have maintained steady relationships with their House and Senate members. We know that the pendulum swings. Republican and Democratic majorities come and go more often than not. We work within divided government to make sure that our progress for those affected by Alzheimer's doesn't slow down because of our system's political swings. And I'm proud to say that we show up to every Congress with a slate of bills to either introduce or continue working on. It probably won't surprise you to hear that increasing our investments in research funding for Alzheimer's and other forms of dementia is a top priority on Capitol Hill. Congress and the President approved this funding through the National Institutes of Health, or the NIH. And the NIH is the largest funder of biomedical research in the world. They award competitive grant funding to research organizations nationally for breakthrough innovations in Alzheimer's treatment, care, and support. In fact, right here in Washington, our own UW Alzheimer's Disease Research Center is currently using some of this funding for research in the UW Alzheimer's community. So first, I'd like to kind of discuss how far we've come with funding for Alzheimer's research. So you can see on this chart Back in 2008, Alzheimer's disease really didn't receive much funding for research compared to other major diseases that were being studied by the NIH. I have a history of Alzheimer's in my own family. I remember the stigma in our society being much stronger, even just 14 years ago. When it appeared in my family, I didn't want to really even acknowledge it, let alone talk to anyone who might not understand what we were going through. Unfortunately, for outdated reasons, that lack of attention in our system to Alzheimer's and dementia made some kind of sense at the time. And again, that was a whole 14 years ago. If we can go to the next slide here, we've kind of come a long way. You can see that things have changed a lot since 2008. And I don't want to spend too much time talking about my own family's experiences with Alzheimer's, but I think it bears saying that this is pretty relatable. I overcame my paralyzing fear of dementia through advocacy, doing something, not only for my own family, but for others. And without knowing it at the time, it would appear that I was joining an army of advocates across the country, breaking through trauma, isolation, heartbreak, everything that we know can come from this disease, not only to break our stigmatic silence and to be able to talk about what we've been through, but even better, using it to provide counsel for elected officials and to improve the lives of other people. Our advocacy for the last 14 years has been relentless, and it's been relentless for a lot longer than that. We now are seeing historic breakthroughs in research, care, and support today because of this commitment. Again, looking at this chart, you can see a full 762% increase in Alzheimer's research funding through Congress since 2008. So moving on to the next slide, I want to give you some background on how congressional activities inform this work. As important as research is, it's one of multiple priorities that we focus on in Congress. We also focus on enhancing care and support available for families who are currently affected by dementia. And as you'll see, this falls under one big umbrella of a really historic approach to dealing with Alzheimer's in our country. So next slide, please. We talked about 2008 being a significant year for us, with Alzheimer's becoming much more of a national priority as we continued to break through that stigma, among other things. And this was the first time that the United States government developed a plan to finally recognize and address Alzheimer's as a public health crisis, which is a big deal in terminology. Next slide, please. So the National Alzheimer's Project Act was unanimously approved by Congress in 2010 and signed into law in 2011. And it required the Department of Health and Human Services to create a national strategic plan addressing the escalating Alzheimer's crisis and to update that plan annually. The first national plan to address Alzheimer's disease was released in 2012. The national plan focuses on promoting rapid research on Alzheimer's disease and the improvement in the delivery of clinical care and services for people living with Alzheimer's and their families. NAPA has fundamentally changed the way the nation addresses Alzheimer's and other dementia and is up for renewal this year. So we're beginning the process of an essential check-in on this plan as we approach 2025. It's important that Congress renews it to reflect progress made towards these goals and what's left to do. The bipartisan NAPA Reauthorization Act would build on the progress that we made in the fight against Alzheimer's and other dementia over the last decade by reauthorizing the National Alzheimer's Project Act, landmark legislation that was signed into law in 2011. The NAPA Reauthorization Act emphasizes the importance of healthy aging and risk reduction for Alzheimer's disease to reflect the new sixth goal of the national plan. The legislation also adds new federal representatives to the NAPA Advisory Council from the Department of Justice, the Federal Emergency Management Agency, or FEMA, as we all know it, and the Social Security Administration. Additionally, the NAPA Reauthorization Act underscores and addresses health disparities among underrepresented populations. The National Alzheimer's Project Act is another of our main priorities in Congress this year, along with renewing the Alzheimer's Accountability and Investment Act, which I'll talk about here on the next slide. So alongside NAPA reauthorization, we're focused on renewing the bipartisan Alzheimer's Accountability and Investment Act, which was originally made law in 2015. This law in particular requires the scientists at the National Institutes of Health, or the NIH, to submit something called an annual Alzheimer's research budget proposal, and they submit that directly to Congress. So that bypasses the usual bureaucratic budget procedures. And this professional budget proposal, also known as the Alzheimer's bypass budget, specifies the resources that scientists need to reach the National Alzheimer's Plan goal of preventing and effectively treating Alzheimer's disease at the national level by 2025. With robust and steady investment, scientists will be able to work faster to advance basic disease knowledge, explore ways to reduce risk, uncover new biomarkers for early diagnosis and drug targeting, and develop potential treatments. With all of this in mind, we are asking Congress to reauthorize the Accountability and Investment Act alongside our other priorities this year. So in addition to research funding, we discussed the importance of renewing NAPA and the Accountability Investment Act together. And if you'll allow me to reference a few other laws that we've passed recently, I think it really helps to illustrate how important the sort of umbrella that our National Alzheimer's Plan has been rolling out has been too in rolling out a whole host of new laws that have been good for the people that we're trying to help. I'll go through these at lightning speed. It might kind of sound a little bit like bragging, but we are very proud of the work. You can see up top here, in 2011, we passed the Alzheimer's Project Act. In 2012, we set the goal to treat Alzheimer's by 2025. In 2013, we passed another funding increase. In 2014 and 2015, the Alzheimer's Accountability Act was passed, followed by that first professional judgment budget. In 2017, we saw Medicare finally begin to cover care planning for cognitive decline. In 2018, the Building Our Largest Dementia, or BOLD, Infrastructure for Alzheimer's Act provided funding to state, local, and tribal health departments to get involved in rolling out our public health infrastructure for Alzheimer's. And most recently, we passed the 3 laws that you see here at the end, reauthorizing a version of the Older Americans Act that better serves those with dementia, another law focused on reducing elder abuse, as well as the Improving Hope Act, which helped get the word out to professional care providers specifically about the enhanced support that was newly available for their patients. So we have made some major steps. And that brings us to the here and now on this next slide here. In 2023, as our state and country continues to become more diverse, we don't want to miss the chance to address the racial and socioeconomic impacts of dealing with Alzheimer's as a public health crisis. And that brings us to the Equity in Neuroscience and Alzheimer's Clinical Trials, or ENACT Act. Through this journey, we've made advancements not only through funding research, but also taking a look at how we conduct trials themselves. We know now, for example, that those most likely to need an Alzheimer's treatment are underrepresented, in fact, in clinical trials. Currently, African Americans, Asian Americans, Hispanic Americans, and Pacific Islanders are statistically much more likely to develop Alzheimer's than are Caucasian Americans. The National Institute on Aging has established centers across the country that offer support and opportunities to participate in Alzheimer's research, and they're well positioned to increase education and outreach activities to these underrepresented populations through this bill. We're very proud to say that Washington's own representative, Jamie Herrera Butler, I referenced her earlier, she's outgoing, was a leading sponsor of this bill. And she was joined in support last year as a co-sponsor by Representatives Kilmer and Newhouse. So we look forward to growing that support in the next Congress. As you'll continue to see, our advocates have pushed Congress to make great progress in the fight against Alzheimer's and other dementia. And thanks to our bipartisan congressional champions and dedicated advocates, federal research funding has grown, and individuals living with Alzheimer's and their caregivers have access to better quality care and support services. But again, much more work remains. Next slide, please. On that note, here's one last congressional priority that I want to leave you with. I know it's been a busy array of slides, but we're excited and we're building more support for it. This one is really about addressing the fact that Medicaid and Medicare were created as systems quite simply before the terms Alzheimer's and dementia were really at all mainstream. And simply put, we have some work to do there as well. We know that an increasing number of Washingtonians and Americans will access their healthcare through these programs in the future. So introduced in the Senate, the Comprehensive Care for Alzheimer's Act allows the Center for Medicare and Medicaid Innovation to test a dementia care management model that provides comprehensive care to Medicare beneficiaries with Alzheimer's disease or a related form of dementia. And this little screenshot here on the right of a tweet from our association brings me to my final point. It's a really good example of how you can help, and we would certainly encourage you to do so. But more on that towards the end. At this point, I'd like to go ahead and turn it back over to Brad for an update on the state affairs side of things. Thank you.
Yeah, well, thank you very much, Nick. And hello again, everybody. I would like to turn our attention now to a discussion around some of the work being done in our state agencies and our Washington State Legislature around issues involving people with dementia and their care partners. If we go to the next slide. Thank you. As you may know, our state has a dementia work group called the Dementia Action Collaborative. The DAC is a work group made up of members of the public, private, and nonprofit sectors, and is run through the Aging and Long-Term Support Administration, or what's more commonly known as ALTSA. The DAC is charged with the development and implementation of the Washington State Plan to address Alzheimer's disease, which was a plan that was originally completed in 2016 and contains dozens of specific recommendations on ways the state can improve services for people with dementia and their care partners. The DAC includes members such as the Alzheimer's Association, who give regular reports and updates to JLEC, which is the legislature's special committee on aging and disability issues. And I think JLEC, if I can remember, stands for the Joint Legislative and Executive Committee on Planning for Aging and Disability Issues, which is kind of a mouthful, and as such, we just call it JLEC. If we go to the next slide. So as I mentioned previously, the DAC does the work to implement the recommendations of the state Alzheimer's plan. And since they began doing that in 2016, they've had some really great wins. You'll see on the slide here, there is a list of some successful projects that the DAC has done to improve services and outcomes for people affected by dementia. But please know this is just a sample, and I just kind of want to run through a few of the highlights to give you an idea of some of the work that has been done to date. The DAC members created a legal planning toolkit and a program also that offers pro bono services to families to help get legal, financial, and estate affairs in order as they go through their dementia journey. The DAC helped to stand up dementia education for providers through the virtual Project Echo platform, which helps primary care providers better interact with people living with dementia. The group worked with multiple state agencies to put together a very successful dementia roadmap so that families would better understand what to expect from the dementia journey. And after the town hall, you will all receive a follow-up email. And I'm going to include a link to the roadmap because it is really great and effective, and you can order them directly from the Department of Health if you work for an organization or agency that provides people with information. And lastly, the DAC developed a Dementia Resource Catalyst program, and these are positions that help make sure that people with dementia have the services they need when they're living in their own home. And there's going to be more to come on that in just a couple of slides. So hold on. If we go to the next slide. Thank you. So as you saw on the last slide, the DAC has done some great work towards the implementation of the recommendations in the state plan, and now is moving forward on their first ever update of the state Alzheimer's plan. Legislation passed earlier this year in the 2022 legislative session charged the DAC with updating the state plan throughout 2022 and 2023. Now that the original plan is more than 5 years old, it's time to take a step back and take stock of the work that's been done to date, the work that's left to do on the original plan, and if and how issues and priorities may have changed over that time since the plan was first released in 2016. And as the DAC does this work to update our state Alzheimer's plan, we're going to need your help and input. They're doing a survey from the end of November, so right around now, through the end of December, and are seeking input from people living with dementia and their care partners and families. So the survey is online, and I believe it was actually just released. And so I'll be sure to include a link to it in the follow-up materials so that all of you can participate. The DAC will also conduct listening sessions in the early spring of next year to continue to gather input as the updated state plan is developed. So the specific dates and times of those meetings will be set soon, and we'll make sure to share those far and wide so that you can all participate and provide input on in that form as well. And you can expect for those meetings to be virtual. So if we could go to the next slide. Thank you. So I'd like to move on now to the Alzheimer's Association's specific legislative priorities for the upcoming 2023 legislative session, which will start this coming January, so just the month after next. So this will be the first in-person legislative session in Olympia since 2020, and with a lot of new legislators and competing priorities on top of the excitement of being in Olympia in person for the first time in a few years. The session promises at the very least to be exciting. It is what we call the long session, which is a 105-day session, which includes weekends. And this is where the legislature will do the hard work of setting the state's budget for the next 2 years. So as we, as a state chapter, develop our policy priorities for the session, I'd like to share with you one ask that we're going to make, which is to increase funding for the Dementia Resource Catalyst program, which I mentioned a couple slides ago. So some of you who have worked with our chapter for a while may remember that the state funded 2 of these pilot programs, these Dementia Resource Catalyst positions in 2021. And specifically, these are positions that are housed within 2 area agencies on aging, and they are tasked with identifying gaps in home-based services to people living with dementia in the areas covered by those AAAs. Another way to say that is that the goal of the program is to provide services with people, provide services to people with dementia who are living in their own homes, with the goal of allowing people to live in their own homes as long as possible, so long as they desire, which not only helps fulfill people's wishes for their own lives, but also prevents expensive long-term care placements. So the Spokane area and Northwest Washington AAA, which is based in Bellingham, are the 2 AAAs that were chosen as the original pilot sites. And those Dementia Resource Catalysts are keeping very busy and showing early success in delivering services to people living in their homes who have dementia. And so to build upon this success, we are going to ask the legislature, as they write their budget, for a little more than $1.7 million to expand the pilot and also fund a program evaluation so that once the pilot is done, we can all see very specifically how the program is working, what services people received, and so forth. And so what is this ask really is to expand the program by 2 more sites, which would bring the total number of sites from 2 dementia resource catalysts to 4, with the goal of continuing to grow that program going forward. So if we could do the next slide. Thank you. So what can you, as members of the public or volunteers, do to help advance our public policy cause? This is a question we get all the time. And so, what you can do is join our group of tremendous advocates that help us in the fight to change the future for people affected by dementia. Our public policy advocates engage in a whole array of activity that you as an individual can choose from at your liberty. For example, if you're a person who likes Twitter, we would love for you to help us out there. If you can't stand Twitter, then just don't worry about it. We can also help you meet personally, either in person or virtually, with your elected officials or their staff, to share your story as it relates to our state and federal priorities. We can help you in writing letters to the editor, or we can also use your help recruiting people that you know into advocacy. Maybe you're at a position where you're very busy, or you're just not quite ready to go live with your story of how dementia affects your life, but you have a friend or family member who you know well, and you just know that they would be good at advocacy and storytelling, that's one of their fortes. If that's the case, certainly send them to us. We are happy to engage anyone who's interested in helping to advance our cause through advocacy. And no matter what, if you sign up as an advocate, regardless of what you would prefer to do, you will receive regular updates from the association about all of the bills and laws that we've discussed today, and any new priorities going forward. So if we could go to the next slide. With regards to specifically state advocacy, one way that you can help right now is to save the date. We are hosting our first in-person advocacy day since 2020, and we're doing that on Valentine's Day, February 14th, 2023. There will be more details to come about specifically when that day and where to meet and the agenda for that day. But now please save the date and come join us in meeting with your local elected officials in Olympia to explain to them the importance of building out an infrastructure to support people living with dementia. If you go to the next slide. Thanks. So if you'd like to get involved in any of our public policy efforts, please feel free to reach out to Nick, who you met a little earlier, and his contact information is here. And we will also share this information with you in the follow-up email. But if you have any interest at all, or know anybody who might be interested, feel free to reach out, and we would love to connect you with advocacy opportunities. Next slide, please. And I want to say before we move on to the Q&A portion, that if you're a person who needs help, please know that you're not alone. You are more than welcome to utilize our national helpline, which you see the number on the screen there, 1-800-272-3900. This 24/7 number is staffed by clinical social workers who can any hour, day or night, answer a great range of questions. Questions like, I see my uncle engaging in certain behaviors. Are these signs of Alzheimer's? All the way to, my grandmother in Fort Wayne, Indiana, needs to find an assisted living facility. How do I help her do that? So our operators are standing by 24/7 to help. So please don't hesitate to reach out if you have any questions at all related to dementia or caregiving. And then finally, I want to take a moment to thank all of you for attending today. It means so much to us that you have an interest in our public policy work. And hopefully some of you will want to continue on and join us in advocacy at the federal or state levels. And with that, I will say Nick and I will be happy to answer any questions that you may have. So what I'm going to do here is pull up the question document here and get going. We have one question here. The first one is from Craig, who says that he's looking forward to learning more regarding the news yesterday around a promising new treatment for Alzheimer's. I want to say that is a great question, and we appreciate you looking for more information on that. The Alzheimer's Association is closely tracking developments in drug research and approval. But that being said, I myself am not the expert on these drugs or developments, but Craig, we have your contact information, and so we will gladly connect you with our chapter's research champion after this meeting, and you and he can have a more specific discussion about the actual specifics of where drugs are in the development pipeline. So thank you for that question. And then the next one is which two counties participate in the Dementia Resource Catalyst program? So there's actually more than two counties because the area agencies on aging represent more than one county each. So there's the AAA in Spokane, which covers, and I'm gonna botch it, but it's like Spokane, Pend Oreille, Ferry, and then another county that I am forgetting. But it's that sort of Spokane and northeastern Washington area, and then the Northwest, which is based in Bellingham, is Whatcom, Skagit, Island, San Juan, and maybe one other, but it's the Northeast and the Northwest sort of portions of the state currently have dementia resource catalysts. And then are we looking into alternatives to Twitter since several appear to be popping up? Yes, Twitter has been in the news quite a bit lately, and there are new social media platforms popping up, which we, our communications folks at the home office, are monitoring. And as those platforms really take off and become sort of main forms of communication, we will certainly engage them. So that is a really good question, since that's kind of actively moving. And then we have, let's see, one more, which is tell us more about Advocacy Day and what to expect. So that's great. So on February 14th, 2023, we at the Advocacy Day, we have rented some space at a church, which is right across the street from the state capitol. And so the plan is to have everyone who's participating meet at that church in the morning. There will be some breakfast food along with a morning program where we will run through all of our state legislative priorities so that you can become familiar with them and familiar with our talking points. and go through a little bit of information around best practices for having a meeting with your legislator. And then importantly, there'll also be time for you to mingle with other people from your district. So you can get to know people that live in your community who will be joining you for your legislative meetings. And then after that morning session, we will all head across the street to the state capitol, where you will spend time meeting with the people that represent your community in Olympia and talking to them about our priorities and sharing your story. And that should all wrap up usually by about mid-afternoon. Usually the last meetings are 3:30 or 4 at the latest. And so please join us for a day of camaraderie and advocacy. And I really look forward to seeing as many of you as possible. And then, what does it take to become an advocacy volunteer? And what is the time commitment? Nick, since you're the one that sort of runs that program, would you mind answering how to become an advocate and what people can expect regarding the amount of time?
Sure, yeah, I'd be happy to, Brad. So I'll say very bluntly that it's no more than like a half hour per month, I would say at the most. There are some people who come to us and are just absolutely on fire about advocacy, which I understand. That's why I do it for a living, and they will, put in like whatever amount of time they want to. But in terms of the responsibility of being an advocate, I would say it's no more than a half hour out of every month. So Brad, you had that kind of host of activities earlier. And I really want to stress that people can pick from that host of activities. The Twitter example is really good. Some people love it. Some people hate it. We have letters to the editor that people can do. We invite people who, I remember when I wasn't quite ready to talk about my journey with Alzheimer's, and I might have been better, referring my friends to advocacy to share their story. So that is even helpful too. But yeah, I would say that the time commitment for being an advocate is no more than a half hour per month. And we invite people to do what they want to do and work with the elected officials that they want to work with. So if you are, just a staunch Republican or a staunch Democrat, if you want to work across the aisle, that is great, but we, don't want to put people into positions that they're uncomfortable in. The main thing is for you to enjoy advocacy. So that's my long-winded answer to that.
Great. Yeah, thank you so much, Nick. Yeah, your advocacy journey is really what you make it. And again, we will be sure to share Nick's contact information after this, so you can feel free to reach out to him and get going with your advocacy opportunities. So I'm looking here, and I don't actually see any additional new questions. So I just want to take one final moment again to thank you all for being here and for your interest in advocacy towards our goals. And I very much hope that you have a great rest of your day and a good holiday season to come and a good new year. So take care, everyone. Have a good day.